operating at the intersection of national security and healthcare. Humanetics is developing advanced radioprotective therapeutics designed to protect both military and civilian populations from radiation exposure, with significant near-term government and clinical applications. Please welcome Rear Admiral Colin Chinn.
So thank you, Kevin, for the introduction. As you mentioned, I'm Colin Chinn, the Chief Medical Officer for Humanetics. And so Humanetics is a clinical stage pharmacy company based in Minnesota. We are developing the most advanced radiation medical countermeasure for the Department of Defense. To date, we have raised approximately $155 million in capital, and $100 million of that is in non-dilutive federal contracts and grants. This year, we will receive $5 million, and next year, $10 million in federal support. So we have the near potential for commercial revenues within 24 months upon our application for emergency use authorization. We also have our intellectual property, which includes fast-track FDA approval and orphan drug designation, which will grant our company 7 years of market exclusivity. So the problem we are trying to solve is an increasing level of global toxic radiation with no means to protect military or civilian populations. The first source of damaging radiation is on the battlefield. The second source is a nuclear power facility accident. And in my lifetime, there have been 3 such accidents: 3 Mile Island, Chernobyl, and Fukushima. But the third and most predominant source of radiation exposure is cancer radiation therapy. And every year, up to 10 million new patients develop solid tumors, which are candidates for cancer radiation therapy. So the solution to widespread toxic radiation is a powerful new radioprotectant called BioGraze, which is also known as Bio300. It was developed by the US military for war fighters on the battlefield. In 2014, we obtained a exclusive worldwide license from the Department of Defense, and we've been in partnership to develop it with them ever since. During this time, we've also identified other indications that could also benefit from the protective power of BioGraze, and that's in the clinical indications in cancer radiation therapy and inflammatory lung diseases. So BioGraze is very easy to administer as an oral suspension. It can be taken orally. There is no need for needles, syringes, or administration by medical personnel, and it's also safe with no serious side effects, dose-limiting toxicities, and it's shelf-stable. So BioGraze protects the whole body from the damaging effects of radiation, and it prevents the development of acute radiation syndrome. This protection is predominantly in the lungs, the GI tract, and the bone marrow. So how does it work? Very simply, it blocks DNA damage caused by ionizing radiation. It also blocks the release of cytokines, which produce harmful inflammation and scarring of healthy tissues. So target markets for medical countermeasures are immense and widespread across several military forces, as we illustrated in this slide. Likewise, the potential market for BioGraze as an adjunct for cancer radiation therapy is also very large. Currently, we have clinical trials scheduled for 3 tumors in lung, prostate, and head and neck. But really, that's only the tip of the iceberg with regard to solid tumors. There's, as I said, up to 10 million new cases every year of patients who could benefit from BioGraze. So in 24 months, we will apply for emergency use authorization with the FDA, and upon their approval, we will obtain a stockpiling order from the Department of Defense. We'll then initiate our initial commercial revenues for BioGraze. And then upon full FDA approval, we anticipate a stockpiling order from Health and Human Services for the Strategic National Stockpile. And then that will be followed by foreign regulatory approvals, and then distribution towards European and Asian markets. And finally, upon completion of phase 2B clinical trials in cancer radiation therapy, we will then collaborate with Big Pharma to commercial biogrades for its clinical indications. So that concludes my presentation. Thank you for your attention. I'm at the corner in the back there. I'd love to talk to you more about this. Thank you very much.